And this surge in case is also causing some cancellations across the St. Louis area. Today, News 4's Gabriela Vidal spent the day asking hospitals if they're going to scale back elective surgeries. She's live from the Central West End tonight. Gabby?
Corey, hospitals in the St. Louis region are either considering or have already started postponing elective surgeries because of how COVID-19 cases now are impacting staffing levels in hospitals as well as access to hospital beds. One St. Peter's woman I spoke to is telling me this is already affecting her.
It's not a question of I can just go on with my foot like this.
Rene Adams has spent the last 14 weeks unable to move on her own.
Non-weight bearing on my foot, and I have to get around on a scooter.
She received surgery on her left foot for a fractured metatarsal back in October, but it wasn't healing.
My heel wasn't at the right spot, so they had to cut it off and move it to a proper position where it should be. And they put 2 pins in it.
She was hopeful she'd get the relief she'd hoped for after another surgery scheduled this Thursday.
Well, they called me last week on Wednesday and said that it was canceled. I asked whether it was due to COVID. She said yes.
News 4 reached out to St. Louis area hospitals. BJC responded saying they're evaluating pulling back elective surgeries to accommodate the rapid growth of COVID-19 patient volume. Mercy says they've already postponed select elective surgeries and contacted patients about rescheduling. Adams says she was told she now may have to wait until March to reschedule her surgery.
That's what makes me concerned. And it's an outpatient surgery. It's not like I'm spending time in the hospital. They will send me home that day.
She says it's frustrating that this new surge could potentially impact more people like her who need medical attention but may now have to wait to get it, which she says is a result of people in the community not doing their part to prevent infections.
I've done the vaccines. I've done the booster. Yet I'm still not able to get a surgery that I need.
Hospitals are still saying that they're seeing people coming into the ER to get COVID-19 tests when they're not severely ill. And so one way that the public can help in preventing hospitals from being overwhelmed is not going to the ER to get these tests and going to other areas where tests may be available. Reporting live in the Central West End, Gabriela Vidal, News 4.
Gabby, thank you.